Hi people, and welcome to Blue Light Bites. These are delicious bite-sized chunks of learning. They are wisdom nuggets, and they're designed to be digested during your break when the only thing on the crew room telly is Towie and you're done with doom scrolling. But before I go any further, I better tell you who I am. My name is Tony. If you know me, you'll know me as a rather weird, wacky and woo-woo ambulance doctor. I work in a response car in Somerset. I'm part of the clinical support team in EOC, and in addition to that, I've been a basics doctor now for 35 years or so. But enough of me, it's time to get to the heart of the matter, or to be specific, the tail of the matter, the horse's tail. Now, if you know what horses look like, and I'm kind of guessing you do, you'll know that their tail is long and stringy, and that is exactly why the end of the spinal cord is called a cauda equina, a horse's tail. And we call it a cauda equina because, well, let's use Latin to make life difficult. Now, the cauda equina is an important thing. Well, all of the spinal cord is kind of important, I guess, but it's important because it contains some very fragile, unprotected nerve roots, and they control lower leg sensation, lower leg power, and they also control the autonomic function of bladder, bowels and sexual organs. Now, if we were to take a spinal column and chop it in half, which by the way is not recommended, particularly at home, it would look a bit like the picture at the top. Yes, this is a happy spinal column. It has a lovely disc between well-preserved bones and nothing is pressing on the nerve root. Now, if you get a slip disc, you're then in the middle picture. You tend to get a slip disc that pokes out backwards and to one side, pressing on a nerve root. And from that disc, you can get the squishy stuff from the centre oozing out, and that causes irritation. And the combination causes sciatica, which results in that classical leg pain that extends below the knee, can be associated with sensory abnormalities and some loss of power, often a foot drop. Now, occasionally the disc will prolapse in a posterior direction, or else it will start going out at the side, and then that will extend around, so it's pushing backwards. And that is when we get Cauda Equina syndrome. That is when the Cauda Equina gets compressed. That's when the trouble begins. Now, why are our backs such a problem? Well, I'm afraid, my friends, we have to blame this chap. This is Arthur the ape. You see, we were designed to go on all fours. Our spines were not designed for the upright posture. And so when Arthur first reared up on his hind legs and said, "Hey, look guys, you can see further if you do this," well, that's when it all went horribly wrong. Yes, the rest is history. And because Arthur did that, we are prone to slip discs. Thank you, Arthur. But slip discs aren't the only reason that people get Cauda Equina syndrome. No, it can be caused by trauma. It can be caused by road traffic collisions. It can be caused by penetrating injuries. Recent spinal surgery is also a big risk factor for Cauda Equina syndrome because you can get a hematoma or an abscess. Now, spinal abscesses can occur in other conditions as well, particularly with IV drug users. And the pain of a spinal abscess tends to be severe. It's unremitting. They often get it at night. It's associated with fever and rigors, and they may well have some localized inflammation, redness and tenderness in the area where the abscess lies. Malignancy can also cause Cauda Equina syndrome, and these patients will have a history often of some sort of malignancy that metastasizes to bone, for instance, breast or prostate. That's another common one. And they will typically have weight loss, they'll have night pain, the pain will be worse when they lie flat or when they strain, cough or sneeze. Now, this is a grown-up podcast, and because of that, we need some numbers, don't we? We need statistics. So here are some statistics. So, there are, at the moment, about 55 million adults in the UK. In any one year, about 50% of them, well, maybe less, 25 million will have at least one significant episode of back pain. Of those, 5% will have true sciatica. But I wonder, what percentage do you think of all the people with back pain will have Cauda Equina syndrome? I think it's time for a drum roll. Let's have a drum roll. Ladies and gentlemen, the answer is about 0.04%. Yes, a very tiny number. Now that statistic does vary according to who you ask and probably on what day of the week you ask them, but it works out at about 1 in 2,500 people who have back pain will actually have Cauda Equina syndrome. So it's rare, folks. It's very rare. It's vanishingly rare. It's as rare and difficult to spot as a needle in a haystack. And who would go looking for a needle in a haystack? Well, in America, there's always someone who would, and his name was Jim Moran. And when the rest of the world was getting ready to go to war in 1939, he decided that he would go looking for a needle in a haystack. If you're interested, he found it near the bottom, slightly left of centre, and it took him a whopping 82.5 hours to find it. Well done, Jim. We're proud of you. But hey, enough trivia. Why are we bothered? Why does Cauda Equina matter so much? Why is it important not to miss this diagnosis? Well, my friends, the answer is simple. If you do find it late or you miss it altogether, you will have some very, very, and I mean seriously, unhappy patients. And unhappy patients creates seriously, and I mean seriously, happy lawyers. Yes, happy rich lawyers. Why? Because Cauda Equina syndrome is a neurosurgical emergency. Yes, those little autonomic nervous system fibres that go to the bladder, bowels and genitalia, they are very, very fine. So they're easily squished, they're easily compressed. And when they get compressed, irreversible damage occurs very rapidly. And if it's not treated properly, there is a risk of permanent bladder, bowel and sexual dysfunction. Urgent MRI and decompression is needed, ideally within 24 hours, but definitely within 48. So it's important that we look for Cauda Equina syndrome whenever we have a patient with back pain. Well, you knew that already. Let's talk about the way we look for that problem. We talk a lot about the saddle area, don't we? We ask if there are any sensory changes in the saddle area, but I wonder if we've actually really considered what the saddle area is. And I guess the best way to do that is to plonk somebody on a saddle. Here we have a Lone Ranger sat proud and upright on his saddle. Now I'm guessing if he had Cauda Equina syndrome, he probably wouldn't be doing that, but let's not worry about that too much now. So Cauda Equina causes pain and altered sensation in this saddle area. And if you look at him, you will see that the saddle area includes, from the front, the genitalia, at the back, the buttocks and the anus, and then the perineum in the middle. But it's not just that, and that is what most of us do tend to think. No, the saddle area also includes the inner thighs. See how they rest against the saddle? The inner thighs. This can also be a place where you have pain and altered sensation. Now, just to cheer you up, that pain and altered sensation may be in a very small area. Yes, it may be one labia. It may be a 1 centimetre square patch of perineum. So it's really important to closely question the patient about any symptoms in the saddle area. Now, what other symptoms does Cauda Equina cause? And I guess we have to just get it over and done with, get it out in the open. It's time to talk about sex. Yes, sex. Now, we don't like talking about sex in Britain because, well, it's not the done thing, is it? But we kind of have to, I'm afraid. So features of Cauda Equina and sex are that if you have Cauda Equina syndrome, you may experience erectile failure. You may lose sensation around your genitals. You may lose the ability to ejaculate. And if you manage that, you may lose the sensation of orgasm. Women may also lose sensation of orgasm. Now, I've got to say, as someone who's had pretty severe back pain in the past, somehow these things weren't quite the highest point on my agenda, but I guess for some people they are. So it's important to ask about sexual function. Moving on quickly to bladder. Yes, we've got the sex bit out of the way. We can now talk about areas in which we are far more comfortable. And we all know that Cauda Equina syndrome causes bladder dysfunction. It can cause a reduced desire to pee. It can cause a reduced sensation during peeing. The stream can be poor and you can lose the ability to start and stop halfway through a pee. It can cause retention and incontinence, which are the things we commonly ask about. But to be honest, by the time the patient has urinary retention or incontinence, really things are getting beyond help. So it's a very late symptom. That's the bladder. Now, just when you thought that the graphics couldn't get any more gross, well, my friends, I can assure you, yes, they can. And they can because I just love AI. So let's talk about bowels. Now, Cauda equina compression causes a loss of peristalsis in the bowel, and this causes severe constipation, and that leads in turn to fecal overflow, that lovely trickle of fecal fluid. In addition, the sphincter relaxes, causing incontinence, and patients lose a sensation of rectal fullness, and they may also lose anal sensation. Now, bowel features are, I'm afraid, very late presentation. So if a patient has fecal incontinence, well, they are literally and metaphorically standing in the poo. On the subject of standing, let's talk about legs. Yes, because the legs go weak and wobbly and wibbly, you often have a progressive and asymmetrical loss of tone and power in the legs. They feel heavy, the foot may drop, you may have an inability to raise legs, and you walk with a very abnormal gait. And that abnormal gait isn't just because of the fecal incontinence. No, it's not. And the legs can give way and patients can stumble and they can fall. Simple, isn't it? It seems very straightforward. But there are confounding factors, folks. Yes, there are factors that can make this diagnosis even more difficult than it already is. One of those being pain. Now, if you've ever had severe back pain, you'll know that starting to pee is painful. It's difficult. That can cause hesitancy, a difficulty in initiating a urinary stream. And the pills that we take and the potions that we take for back pain can also confound the picture. So let's think about some of those. Now, amitriptyline is a very commonly prescribed medication for back pain. It's good for chronic pain and also helps patients to sleep when they've got a lot of back pain which is affecting them at night. But amitriptyline does cause side effects which can mimic Cauda equina syndrome. It can cause urinary retention, it can cause urinary hesitancy, it can make the stream weak, and particularly if they're elderly, it can cause them to topple over and fall. Opiates, of course, are another big player when it comes to back pain, and they too can cause constipation, urinary retention, and falls. Benzodiazepams, used less commonly now, but still sometimes used for back spasm, they cause incontinence, they cause lower limb weakness, and they too cause urinary retention. And then we get onto the gabapentinoids, yes, the pregabalin and gabapentins of this world. They, in turn, cause urinary retention, you guessed it, incontinence and ataxia. So it's really important to get a drug history, and particularly to ask the patient, did their symptoms start when they started these medications? So, key questions when taking a history. When did the symptoms start? It's really super critical to know the time of onset of symptoms. Remember, you have a very limited treatment window. So you must know when the symptoms started. And did they start suddenly or did they come on gradually? And have they changed? In particular, has pain changed from being unilateral to bilateral? That is a big red flag. We don't like that. That is a sign of Cauda equina. And then we must ask them about sensory loss. Yes, in the bladder, the bowel and the bits. One easy way of doing this is to say, does it feel any different when you pee, when you poo or when you wipe? Ask about urinary and fecal incontinence and retention. Ask if you're going to have to remember sexual dysfunction, and ask about leg weakness. So my friends, what can we take away from this? How can we bring it all together? Well, these are the key messages. These are the takeaway messages. Back pain and sciatica are common. They are super common. Cauda equina is rare. Rare. It's vanishingly rare, but we cannot miss that diagnosis because it is a time-critical neurosurgical emergency. Delayed or misdiagnosis can be catastrophic, not just for the patient, but also for you and, got to be said, for the trust as well. So whenever a patient has back pain, think Cauda equina. Ask the questions. Document that you have asked the questions and document the answers and document carefully. Thorough safety netting is also really important. If a patient gets any of these red flag symptoms, they must go to ED immediately, or if they can't get them under their own steam, we're going to have to take them. And just to make life a little bit complicated, I'm afraid, my friends, there is no clear presentation of Cauda equina. Any of these features can occur in any combination. Yes, the presentation is very variable. There is no specific diagnostic pattern, and so you always have to be on your game and alert. But of course, having watched this, you will be. You're never going to miss a diagnosis of it. It's great. Job done. Simples. So I hope you've enjoyed this edition of Blue Light Bites. If you have any friends who aren't imaginary and they're in the ambulance service, do tell them about it. Show them the link. And join me again next month when we'll be talking about chest pain in children. Chest pain in children, another thing that causes great angst, particularly for parents and also for ourselves. So I hope to see you then. But until then, I wish you well, stay safe, and goodbye.